Fascia iliaca block is a regional anaesthetic technique used predominantly for analgesia for hip fractures and femoral shaft fractures. It can be done under ultrasound guidance.
Prior to starting this procedure, make sure you are aware of the indications, contraindications, and local anaesthetic to use and have got consent from the patient. We use the linear probe on the nerve setting of the ultrasound machine. Begin by identifying the anterior superior iliac spine and the pubic symphysis, and approximately halfway with the probe marker pointing to the patient's right, or 9 o'clock on the clock surface. Start by trying to identify the neurovascular bundle of the femoral vein, artery, nerve from medial to lateral. Here on the image right, you see the femoral vein, then the femoral artery, and next to it is the femoral nerve, which can be quite hard to see, but is often described as grey and at certain angles with little black spots that looks like a cookie dough. Lateral to that is the sartorius muscle and the iliacus muscle. When you've identified your femoral nerve, you know where the fascial planes will run onto. To find the fascial planes, you can follow the muscles down to the femoral nerve. So identify the sartorius muscle and the iliacus muscle, which is usually next to the femoral nerve, followed by the femoral artery and vein medially. The fascia lata runs over the sartorius muscle, and the fascia iliaca runs over the iliacus muscle and round the femoral nerve. When doing this procedure, we perform it in line with a needle coming from lateral aspect. We go through the fascia lata, through the sartorius muscle, and then insert local anesthetic just under the fascia iliacus over the iliacus muscle. This will lift the sartorius muscle, and the local anesthetic will expand the gap between the iliacus and the sartorius and run along onto the femoral nerve.
This completes the ultrasound guided fascia iliaca block.